See about nursing F is a question paper model test series, and it is a question paper and content series. That means a question paper along with the explanation will be there, and it will help you to clarify your doubts about the question and their answers, and it will give you notes about the question also. So please understand the question clearly and answer it in a timely manner. It will help you for Jipmer, Norcet, aiims, PJ, ESA, and other central and state institutes. Coming to first question, what is the causative agents for measles? Variola virus, varicella zoster, paramyxoviria, myxovirus. Paramyxoviria, myxovirus. The answer is myxovirus. What is the causative information? Myxovirus. Variola virus is for smallpox, varicella zoster is for chickenpox, paramyxoviria is a genus family, it's for mumps, myxoviria for measles or rubella. Also, sometimes question will be what is the other name of measles, rubella. Generally, communicable disease can be classified as waterborne, airborne, vector-borne. This is for information. So please try to understand what are the types of diseases in communicable diseases. What are the types of communicable diseases? Okay. Sometimes question will be what is chikungunya is a vector-borne, airborne, or waterborne. Okay. Please take a screenshot and remember during the exam. This is very important. Chickenpox, also known as shingles, it's a varicella virus. Smallpox, it's eradicated in 1980. Variola virus, mumps, paramyxoviridae. Rubella, also called as German measles. Sometimes question will be other name of rubella, Japanese measles, German measles, Russian measles. So try to learn it properly. RNA virus of tocovirus family. Sometimes question will be DNA virus of tocovirus. Don't get confused. So you have to remember it very correctly. Diphtheria, corynebacterium diphtheria, pertussis are also called as whooping cough. It's a Bordetella pertussis. Poliomyelitis, poliovirus, cholera, vibrio cholerae, tuberculosis, mycobacterium tuberculosis, meningococcal meningitis, Neisseria meningitis, influenza also called as flu. Influenza A, B, C, D also are there, but B and D only affects human being. Plague, Yersinia pestis, anthrax, Bacillus anthracis, rabies, rhabdovirus of genus Lyssavirus, hepatitis A, B, C, D, hepatitis A, B, C, D viruses, Ebola, also called as hemorrhagic fever, Ebola virus, COVID-19, SARS-CoV-2. Sometimes the question will be SARS-CoV-1, 2, 3, 4. So answer is SARS-CoV-2. Typhoid fever, also called as enteric fever. Why it is called? It affect enteric intestine. So that's why it's called enteric fever. Salmonella typhi. Swine flu, H1N1 virus, and measles, also called as rubella, myxovirus. That was the question. Coming to second question, due to purgation and posterior drainage of the lungs in bronchitis, what position of the patient then asked to use? This is a little confusing question, but you try to answer the in a clear manner. In COVID-19, what are the position used for the patient to facilitate the drainage? All we know it is a prone position, so don't get confused. Sometimes we will confuse with the semipolar position, but don't get confused. Okay, bronchitis disease is a permanent enlargement for of the lungs and way. Posterior drainage is a gravity-based method. That means it takes secretion from alveolar to bronchial and to the outside. So these are positions. Supine positions will be like this, and prone position will be like this. Right lateral decubitus will be like this. Left lateral decubitus will be like this. So these are the position according to the lobes. Sometimes they will ask this question, but try to understand it. Mostly they will not ask, but try to understand. Sometimes our luck they might ask. And this is a technique of percussion. And these are the common position: prone, supine, fowler's, Sims position, lateral position, semi-fowler's position, and tenderbar position. You also know what are the position and what are the uses. Semi-fowler's and ifowler's also for respiratory condition. Sims position is for what? Perineal examination. Lateral position, same. Prone position, lung, and tenderbar position for shock and some surgeries. Okay. This will discuss later. Antidote for benzodiazepam. Naloxone, flumazenil, pyostrychman, neofuroxamine. What is the answer? Yeah, it is flumanicil. So naloxone is for OPR, flumanicil for insertion, hyostigmine also called neostigmine is for anticholinergics, and D for upsamine. It is for acute iron toxicity. Okay, so these are the drugs and the toxicity. It is antidote. So please note this, and it will help you for exam. If you want, you can take screenshot. Aspirin, sodium bicarbonate, acetophenone, paracetamol, N-acetylcysteine, anticholinergics, hyostigmine, comedine, morphine, vitamin K, digoxin, sometimes digoxin, immune fab, digoxin, digiband, A and B, like that's also question will be there. So it's a trianum, it is a generic name. Organophosphorate poisoning, atropine, arsenic, gold, mercury, all three dimercaprol. Poison by mouth, activated charcoal. Any poison by taken by mouth will be easily neutralized by activated charcoal. So poison, any poison by mouth, activated charcoal. Anticholinergic, pralixidomine, paroxamine, anticholinergic, pralidoxamine, heparin, protamine, carbon monoxide, oxygen, iron, dextroxamine, methanol, ethanol, calcium blockers and beta blockers. Easily you can understand glucagon. Triglyceride antidepressant, sodium bicarbonate, isoniazid pyridoxine, cyclophosphamide. It is a anti-cancer drugs. Misna. Actually, this it is not an antidote. It reduces the effect of the toxicity of the cyclophosphamide. It is an antidote. Okay, and just remember that methotrexate, folinic acid, insulin, glucose, magnesium sulfate, calcium gluconate, cyanide, methylene blue. Coming to next question, which condition of the following would results in left to right shunt? So left to right shunt we have remembered in cardiology, but in lungs they were asked this question. It is a little confusing question, but if you think properly, you can answer it very easily. It is pneumonia. Answer is pneumonia. Alveoli affected with pus and perfumed but not ventilator. So this causes left to right shunt as blood supply to those vessels supplying this pus filled alveoli by bypassing the lungs. So which causes the left to right shunt. These are the different diseases and under their signs and symptoms. Please remember this. If you want, you can take screenshot. Next. Which of the following ABG is consistent with metabolic alkalosis? You should know what is metabolic respiratory and alkalosis, what is acidosis of respiratory and metabolic. pH 7.45, PaCO2 50, HCO3, that means bicarbonate 30 milliequivalent, PaO2 90%. Here the abnormal, nothing looks abnormal other than this. So answer will be HCO3. It is a quite twisting question. 7.45 is a border. So you should not get confused. Okay. So bicarbonate is answer. These are the normal values. Please take screenshot. It will help you for exam. What is the normal value of each things? It is a metabolic alkalosis. We can easily tell what is alkalosis, acidosis. pH below 7.35 is called acidosis, above 7.5 alkalosis. PaCO2 is for respiratory, PaCO2 and PO2 is for respiratory. Bicarbonate is for metabolic diagnosis. Okay. O2 saturation is also for respiratory. Next question. What are all standard precautions should nurse use while carrying HIV infected patient while doing suctioning? Okay. Here the two twist is HIV infected and suctioning. It's a correct. You have to understand the key of this question. Sterile gloves and eye protection, mask, sterile gloves and face shield, mask, gloves, gown and face shield, mask, gown and gloves. What is the answer? Sometimes you may get confused with B and C. The answer is C. As per the guidelines, gown also needed. Okay. Please take the notes. And washing gloves, the things, everything, what you need to do, all things. Okay. And One more thing is, if you want to full details of each and every disease, you can go through this website, CDC website. Find out the diagnosis. It is a ventricular tachycardia, ventricular fibrilla, atrial fibrillation, torus it is pointed. What is the answer? Yeah, it is ventricular fibrillation. Ventricular fibrillation having no recognizable P waves or Q wave complex because all electrical are disorganized. So there will be no proper wave, there is no regularity, nothing is there. Oh, that is called ventricular fibrillation. What is ventricular tachycardia? Or ventricles usually present, but not always. What usually present, but not always. It is a regular. See, it is a regular form, and rate will be around 150 to 250. QR is more than 0.212 seconds. Okay, it is a regular pattern. You can easily remember. And atrial fibrillation. Atrial fibrillation is its heart is fibrillating. Atria only fibrillating. Okay, it's like fibrillating. Heart is fibrillating like this. Okay, PVS are absent. It is a irregularly regulated. Sometimes it will be 3 box, it will be 5 box, but it will be 3 box. Okay, this pattern, like see, if your heart is resonating, only this way is forming. Okay, torsity pointers, there is no regularity. There is no ventricular compress varies. You see, in ventricular tachycardia there is a regular, but in torsion you can it's like a earthquake waves. Just coming to next question. Hormone which is responsible for milk ejection is, the question, don't get confused, milk ejection and milk production differs. Prolactin, follicle stimulating hormone, oxytocin, vasopressin. And the answer is oxytocin. Yeah. And these are the hormones under their responsibility, under their under their functions, sorry, under their function. Hypothalamus hormone, pituitary gland, anterior, posterior are there. Posterior secretory. Sometimes question will be oxidatory is a anterior lobe, posterior lobe, pituitary pineal gland, thyroid gland. So answer is posterior. So please remember this. If you want, you can take screenshot of this. And there will be a hormones list under their function, and it is regulated by which organ of our body, the function. Okay, this is important. Okay, take notes of it. Coming to next question. Suboccipitopragmatic diameter is fetal skull. Remember fetal skull. A 13.5 centimeter, 9 centimeter, 8.5 centimeter, 9.5 centimeter. Subpragmatic is very important diameter in fetal life with the mother bone. Why? Anybody knows? Please tell. Okay, it is a position of the fetus to the pelvis. That's why. So occipitofrontal is 11.15 centimeter. The answer is 9.5 centimeter. These are the other centimeter. Occipitofrontal, which follows a line extending from the just above the root of the nose to the most prominent portion of the occipital bone. Biparietal is 9.5 centimeter. Bitemporal 8 centimeter. Occipitomental 12.5 centimeter. And suboccipitopragmatic, it is a 9.5 centimeter. Okay, take the notes. And these are the diameters. These are the diameters and the centimeters and their attitude and the presentation. So what is a common presentation? Suboccipitopragmatic vertex presentation. It's a complete flexion. This is a common position of the fetus. So please remember that. Operating surgeon who blames nurse as he did not have good outcome. Which different mechanism used? Rationalization, compensation, repression, projection. Yeah, we project the things to the nurse. So it is a projection. These are the common mechanism. Please take a screenshot and read it properly. This will help you for exam. Please.